Okay, today we are going to be talking about thoracic cases that are performed in the supine position. The most common thoracic cases that you will see with the patient in the supine position, usually with their arms tucked at their sides, but they could be out on arm boards, is for bronchoscopy and mediastinoscopy, or CME. Another one would be a thymectomy. So the patient is already in the supine position with their arms tucked, and whenever we're doing any type of thoracic surgery, we want to hyperextend the neck. So the patient would have a donut gel head roll, as well as an axillary roll to be able to push out and hyperextend the neck, especially in a mediastinoscopy and a bronchoscopy when we're working in the area of the pharynx and the trachea and such. Okay, so for a bronchoscopy, there is usually no prep done because we are going through the mouth. All you might see is when I get gowned and gloved, or maybe not even gowned and gloved, this is considered a clean procedure, not a sterile procedure. And usually the patient just has some type of a blue towel or similar placed over them for the bronchoscopy. Because again, it is a clean procedure and not a sterile procedure, but it is set up sterilely. Okay, now the next thing we're going to do is we're going to do the prep for a mediastinoscopy. Now, a mediastinoscopy is considered a sterile procedure, okay? The incision is going to be made about a centimeter or two above the suprasternal notch. For a mediastinoscopy, we need to be able to prep the entire chest out, as well as the anterior neck. So we're going from chin and then bedside to bedside, all the way down the anterior chest, bedside to bedside. So we're doing the neck and the chest. The reason for that is in the event that the great vessels or any uncontrollable bleeding occurs during the prep or intraoperatively during the procedure, and we would need to cut the chest open, then we need to be able to have access to it. So, patient is in the supine position, same positioning aids, the headrest, the donut headrest, the axillary roll to hyperextend the neck, and now I'm going to be doing the prep on the patient. And we're going to start at the area of the incision site. The area of the incision site on a mediastinoscopy is the suprasternal notch. So we're going to start in a circular motion at the suprasternal notch, and we're going to do the entire anterior neck all the way up to the chin. And then we're going to go down the area of the sternum from the manubrium all the way to the xiphoid process. Okay, and then we're going to be going out in a circular motion. And we're going to be going basically bedside to bedside. And we're doing the entire chest. And then once that is done, we let that dry. Duraprep, Chloroprep, or a beta-beta could be used. So again, the prep parameters for a mediastinoscopy are from the suprasternal notch, the entire anterior neck, up to the chin, just below the chin, down the sternum, the anterior sternum, and then the entire chest, bedside to bedside, down to just below the xiphoid process.